Apoptosis is a form of programmed cell death that occurs in multicellular organisms. Biochemical events lead to characteristic cell changes and death. These changes include blebbing, cell shrinkage, nuclear fragmentation, chromatin condensation, chromosol DNA fragmentation. The plasma membrane of the apoptotic cell remains intact, but the membrane is altered in such a way that the fragments, called apoptotic bodies, become highly edible, leading to their rapid consumption by phagocytes. The dead cell and its fragments are cleared with little leakage of cellular contents, so apoptotic cell death does not elicit an inflammatory reaction. Apoptosis occurs in many normal situations and serves to eliminate potentially harmful cells and cells that have outlived their usefulness. It also occurs as a pathologic event when cells are damaged, especially when the damage affects the cell's DNA or proteins. Thus, the irreparably damaged cell is eliminated. Physiologic apoptosis. During development of an organism, some cells die and are replaced by new ones. In mature organisms, highly proliferative and hormone-responsive tissues undergo cycles of proliferation with cell loss that are often determined by the levels of growth factors. In these situations, the cell death is always by apoptosis, ensuring that unwanted cells are eliminated without eliciting potentially harmful inflammation. After the immune response, excess leukocytes in the immune system are eliminated with apoptosis, as well as lymphocytes that recognize self-antigens and could cause autoimmune disease if they were not purged. Apoptosis in pathologic conditions. Apoptosis eliminates cells that are damaged beyond repair. This is seen when there is severe DNA damage. The accumulation of misfolded proteins also triggers apoptotic death. Certain infectious agents, particularly some viruses, induce apoptotic death of infected cells. Apoptosis is regulated by biochemical pathways that control the balance of death and survival inducing signals and ultimately the activation of enzymes called caspases. Two distinct pathways converge on caspase activation: the mitochondrial pathway and the death receptor pathway. Although these pathways can intersect, they are generally induced under different conditions, involve different molecules, and serve distinct roles in physiology and disease. The end result of apoptotic cell death is the clearance of apoptotic bodies by phagocytes. You can watch our apoptotic pathways video for more information. Do not forget to like the video and subscribe to our YouTube channel.